So hello everybody, I'm now calling in from London, UK, and it's Tuesday the 15th November, and with me today I have Ulla Taylor, a school friend who has asked me questions about potentially investing in PILA Pharma. But Ulla, you have some questions for me, so I thought we could do it here online.
Yeah, that's fine. I was wondering, I have never been into the stock market before. So I was wondering, where do I begin? How do I get from
Buy the
thought
shares?
to action?
Yeah. So if you've never owned shares before, you probably don't have a depot in your bank. Normally, if you own shares, you have them in a depot in the bank. That can be like your normal bank, or it can be one of those online banks in Sweden and Denmark. There's Nordnet, and also in Sweden there's Avanza. I think they're really well working and good. And you need to, if you haven't started a depot yet, you should create it. But since we end the subscription period by the banks tomorrow, and just there, I think you should go for the second possibility to sign up for shares, and that is via our homepage. You have a page under investors, front page, and then we have different pages. And investors, we have made a site with information about this issue, and there's also a link, and I think also we have put up subscription notes. That means forms you have to fill out with all your details, personal details, and then you have to sign it. You can do that digitally, that's fine, but you have to sign it, and then send us via mail a PDF. And that's not me. You should send it to Nordic Issuing, Johanna. The contact details are there. Then you will get into the stack of subscription subscribers that we will look at. I think it's next Tuesday, and see how many people have subscribed. So it's not so complicated. But then before you can get your shares, you have to get them.
But once I have signed in by your web site and have signed it in the bank, the online bank, then I am in the list, and then I have begun my journey on the stock market.
Not yet. Well, you have started your journey on the stock market, but the process is that we offer for sale these new shares, and then those who are already shareholders have preferences, so they will go first. And then everybody else can also sign up. So we have a limit to how many new shares we will issue. We will make new shares, and so if there's so everybody who subscribe for shares will be kind of listed, and then when we get that list, we will see if all the shares are subscribed for. Everybody will get their. I mean, if they're not more subscription than what we have shares, then everybody will get them. But if more people have subscribed than what we have shares, then we have to allocate and choose who we prioritize. Okay. And I say we, it's me, because I'm also in the board of PILA Pharma. It's the board that decides. So the issuing agent will come with a list, and they will give a recommendation. But eventually it's the board that decides. But we can't see the names unless you actually make this note, because then of course we see that by the banks we can't see the names. So
I'm just a normal school teacher, so I don't have a lot of money, but I have a small amount of money that I would like to invest, and of course I want to choose your company because I think it's very interesting, and I have heard about it. You have talked about it for so many years, and I have seen your passion, and I have seen your stigma, and I'm sure this is going to be a fantastic new thing for manhood, for mankind actually, and for the people with the diabetes as well. So, but if I want to start my investment, how small an amount of money can I begin with?
Yeah,
so I don't risk my house and my dog.
Yeah, no. Yeah, you should. So first of all, it's considered a high risk investment. So I mean, we have great ideas, I think, behind this project, and we have great drive and passion for it. And I think I have taken it quite far already, but there's still a long way to go, and there are many risks on the way. So there is a risk that you can lose everything you invest, and you should be, be ready for that. And I personally actually reinvested or subscribed for new shares today, so, via Nordnet, where I have my account, and there I saw that the minimum amount was 1,000 shares, and they are sold now for 3 Swedish kronor per share. So the minimum would be 3,000 Swedish kronor.
All right, but that's not a big amount. So but then
for some people it is,
yeah,
but
okay, yeah, but then we have begun.
Yeah, but then it should be up to you. And I think, of course, it's wonderful that even my friends but also people I respect and who are smart within their field and consider to support my project. Of course, I think before we made this issue, I saw we had 1,710 shareholders, and that's really fantastic that so many people have decided to go on board in this. And I hope, of course, we make a great case for all of us. Other questions you have on your mind?
Yeah, I was wondering, do you have any enemies in this? I don't know if we can discuss that, but have you any enemies in this? Do you have somebody working against this thing? That sounds to me like it's a big challenge, udfordring.
Yeah, challenge or
it would be a big challenge to for example Novo, the company that is having the majority of the market, I suppose, of insulin, and yours are the alternative of insulin, right? Or is it?
Well, it's a different mechanism of action, and we know that our molecule actually makes your body, your own insulin, you make it secrete more. So it's a little bit like the GLP-1, semaglutide, and these products, just by another mechanism of action. It's a little bit too early to see if we will actually, like on the efficacy side, will be as good as they are, because they're really good products. But I have worked with their products, and I have invested a major part of my own grown-up career for this project, because I strongly believe that we can come up with a product that is safe. It seems from the clinical studies we've done so far, it's safe, that has good efficacy. Of course, it should regulate glucose, but also there will be other effects on some of the comorbidities. And then it's a really small tablet, so that for sure will be a challenge, and I hope we can price it low. I think it's an alternative maybe for a different segment of the diabetes population.
Yeah, because so we have actually very many variations of diabetes as far as I am aware of.
So this may fit better to one sub-segment, but it's also the segments in the world, so to speak. There may be segments where they don't have access to the very best and most expensive treatments. So affordability is an issue for a number of diabetes patients. And I think we could tap into that maybe. So maybe we can be complementary to the existing products. Of course, there are already some diabetes products in the market that are low cost because their patents have expired, or they have maybe a little bit of side effects or a little bit too good or too little efficacy. But we will benchmark, I hope, hopefully with the best. But then I hope that we can find a partner that will go for the mass market, because there's a thing to do to get the accessibility for all diabetics to good treatment. And this is not the case today. So, but of course, competitors, well, right now it's more like we are raising funds, and a lot of other biotech companies are raising funds. So it's more competition for money right now.
Maybe I've seen too many movies.
Yeah, but it's for sure. I don't know exactly how the competition space is. I think I have a good idea about it, but we're still a little bit far from the market. So, but that can be, they can put a stick in the wheel on the go if somebody doesn't want us to succeed. And for sure, then we are just, the mouse and the elephant story, but or David and Goliath. But we all know how that went. So let's. I'm not so afraid about that. I'm a quick thinker, and I've managed so far through, dangerous area. And I think you have to be common sense and keep your eyes open and think a solution, and then think about the power of the universe, so to speak. If there's a need for this product, there will be forces that will also help us forward. And this I have felt a couple of times, so I hope we will get all the way out there to make a difference.
I'm sure you will. I'm sure you will.
Other questions you have on?
Well, no, I don't. I think I will go to your web site now and try and find out what to do with my little amount of money, but that I would like to invest in PILA Pharma.
Yeah, I was just thinking, if you go to the PILA website, I was just about to see if I could maybe share that, but I'm not so technically skilled for that. Anyway, you have to go to the website, pilapharma.com, and then up you can choose different menus. Go to the investor, and there's a drop down menu, and click on the it says emission 2022, I think, or rights issue, I think it says 2022, and there you can find all these documents and information in it. So I hope we'll succeed with that.
I'm sure we will.
Yeah. Okay, Ulla, if that's all, I think I would like to thank you for being a good friend and also maybe a future investor in PILA. And I hope you got answers to all the questions.
You have. Thank you.
Okay. Thanks a lot. Bye-bye.
Welcome. Bye.